question is, I have a 2-year-old Labrador and I'm really struggling with his lack of focus and ability to listen due to his hormones. Do you think I would be okay to neuter him now, or should I wait? It just feels like a big decision. Removing any part of a pet's body needs careful thought, especially when it is healthy, as in this case. And when considering whether to proceed with surgery or not, it's essential to weigh up all the pros and cons. In this scenario, the first thing to bear in mind is that many male dogs, like adolescent teenagers, pass through a troublesome phase between 1 to 3 years of age. Although this is quite normal, it often involves elements of behaviour which can be difficult to manage. Depending on temperament, these may include a refusal to listen to or follow instructions, the pushing of boundaries, lack of focus, and an increased desire to interact with other dogs, which results in play or aggressive behaviour being far more interesting than training exercises or paying attention to their human companion. With perseverance and positive reward-based support over a considerable period of time, many such dogs can be helped through this stage of development and come out the other side as well-adjusted individuals full of character with good behaviours. There is a small percentage, however, that fail to make such progress, and this may well be due to the potent impact that male hormones can have on instinctual urges, mental, emotional, physical well-being, along with mood and behaviour. And it is these dogs that can benefit from neutering. There are 2 provisos, however. Firstly, it's good to make sure that the diet is not contributing to the problems faced. A sensitivity to sugar, carbohydrate-rich foods and additives can fuel hyperactivity and ADD-type behaviours in dogs, in the same way that fizzy drinks and similar products can have some children climbing the walls. Switching affected dogs from a commercial dog food or kibble to a raw or home-cooked diet frequently results in a marked improvement in focus, demeanour and behaviour. And when this is the case, castration may well be unnecessary. Secondly, it's possible to gauge the effect of castration prior to committing to irreversible surgery by the administration of a drug which blocks male hormones for a trial period. If the changes seen in temperament and behaviour are positive, then going ahead with neutering is likely to result in the desired outcome. If this is not the case, the impact of the drug will wear off. Gaining an insight as to what the future may hold post-surgery is important, as occasionally personality can change to such a degree following the removal of the male hormone influence that a pet parent feels that their dog is no longer the individual they knew and loved. With regards to timing, testosterone is vital for the normal development of joints, bones, and the rest of the musculoskeletal system until maturity is reached. The exact age for this varies depending on the breed and size of the dog. As a general guide, this is around 18 months for smaller dogs, 24 to 30 months for large dogs such as Labradors, and 36 months for giant breeds. Castrating too early can lead to an increased risk of musculoskeletal problems developing late on in life, such as cruciate ligament disease. If the decision is to go ahead with castration after considering these different elements, a couple of measures are important for the best outcome. Firstly, the daily food ration should initially be reduced by around 25% to prevent excessive weight gain. This can be adjusted up or down accordingly after a few weeks to maintain an ideal body condition. And secondly, it's essential to continue with positive reward-based training until the desired behaviours become second nature.